Hello and welcome to a discussion on the sexual differences in the pelvis. Right. So the differences between the male and the female pelvis are principally associated with features such as heavier built muscles and stronger muscles in the male, which account for the stronger pelvic bones in the male as compared to the female, as well as well-defined muscle markings for the muscles on the bone, right? Whereas the female pelvis is more adapted to parturition. So you'd find that the pelvic cavity is actually going to be wider or roomier, and it's going to be shallower as well in the female, right? If you look at the pelvis, the pubic arc is going to be almost 8 to 90 degrees in females, whereas in males it's going to be a bit acute, almost 50 to 60 degrees, right? And the sacrum is tilted backward in the female, whereas in the male, the sacrum is tilted forward, right? And iliac peculiarities in the female pelvis give rise to the greater prominence of the female hips, right? Then in relation to the sacrum, the male sacrum is going to be longer and narrower, whereas the female sacrum is actually going to be shorter, and it's also going to be wider, right? The auricular surfaces which articulate with the iliac bone, in the female, they're going to be shorter, whereas in the male, they're actually going to be longer, right? And the curvature of the bone, there is a gentle and uniform curvature in the male sacrum, whereas in the female, the sacrum descends nearly straight in its upper part, and the lower part is the one that actually turns forwards. Right? Those are other differences. I won't dwell on that. Then there's the sacral index. The sacral index is calculated as breadth of base of the sacrum divided by anterior length of the sacrum multiplied by 100. And you can appreciate that the sacral index is actually more in females, 116 as compared to the 112 on average in males. Right. Then I talked about the wide arc. Then this arc is wider in females, and it's going to be more rounded, right, as compared to the acute pubic arc that you find in the male, right? Then the greater sciatic notch is usually wider in females, right? And it's almost 74.5 degrees in the females, and in males it's going to be more acute, about 50 degrees, right? And there's what is known as the sciatic notch index, which is used by clinicians. It's more in females, right? And there's the kylotic line, which is a line that extends backward from the iliopubic ramus to the iliac crest, right? And this kylotic line for males, it's almost 115 to 120, whereas for females, it's in the range 80 to 100, right? Then there's the ischopubic index, which is the length of the pubis divided by the length of the ischium multiplied by 100, right? And this index has a gynecological significance, and it will help estimate the outcome of labor. And it's about 91 to 115 in females, right? And if you look at the differences in general, the general structure, the male pelvis is heavy and thicker, whereas that of the female is going to be light and thin. Then the auricular surfaces, we say they are larger in the male and smaller in the female. Then muscle attachments, we say they are well marked in the male and indistinct in the female. And if you look at the pelvic inlet, it's going to be heart-shaped in the male due to the indentation of the sacral promontory, and it's oval in the female. Right. The pelvic outlet is smaller in the male and it's relatively larger in the female. Right. And if you look at the acetabulum, it's larger in the male and smaller in the female. Then the ischial tuberosities in the male, they're going to be invated, whereas the ischial tuberosities in the female are evated. The obturar foramen is also different. For the females, it's small and triangular. For the males, it's large and oval. Right. Then the preauricular sulcus, it's more frequent and better developed in the female and not frequent in the male. Right. And the ilium tends to be vertical in the male, and the symphysis also lies at a higher level in the male. Right. And remember, I said the subpubic angle is almost acute in a male, and it's going to be V-shaped. Right. Then the pelvic brim, heart-shaped, then circular or elliptical in a female. Then the true pelvis is relatively smaller in the male, whereas in the female, it's oblique, swallow, and quite spacious. But if you look at the false pelvis, it's actually deeper in the males.